today marks 1 full year of 52 straight virtual support groups of all of us together.
Right on.
Yes,
Yay.
52 straight.
Wonderful people. That's why I'm here.
Yeah, it's we feel the emotions. We definitely share it with you, Raphael, and keep pushing. And so here, with our 52 straight weeks together and beyond, right? And so we have all over California. I mean, take a look here. From Northern California, Central to Southern California, we occasionally have different states here.
Canada.
Illinois, Kentucky. We have 2 from Canada. Oh my God, Canada! Yeah, right?
Yeah.
All over, right? And so if
Yeah.
COVID has been a bad thing, but if we had to look at a silver lining, it has brought us all together.
Yeah.
And all not only together, but all together to find steps to progress towards our recovery. And so I'm very,
Yeah.
very blessed and fortunate to welcome Katie DeMito from Amen Clinics to discuss HBOT and recovery and beyond. So give a brain injury welcome to Katie DeMito, Amen Clinics. Yeah.
Hi. Welcome. Thank you guys so much. Oh my gosh. I want to say it's like one of the great privileges of my career to be able to be in the presence of you amazing people. I first got tied in with you when I was, I met Daniel through Bjorn Hazelquist, who is a brain warrior for sure, amazing guy. And I started going to the groups every once in a while just to understand more about what resources exist, because we refer out quite a bit. I feel honored. I was running around my house finding sweaters and doing things. And I heard Amen Clinics come up a few times. I also heard Hyperbarics come up a few times. And I think that's really cool. And I've just been so impressed with you all over the last year of COVID, especially. Daniel was so kind and he invited me to come and speak one of those first weeks of COVID.
Yeah.
And I think I was just at home with the new baby. I thought I could pull it all off and I just couldn't. And it was like, you guys were so warm and so kind and so flexible with me. And I could blab on, but I find inspiration through you guys all the time. So I do have a screen to share and I will do that right now. Let me just close out this window.
Are you one that's a survivor or you are a doctor?
I am not a brain injury survivor. I work for the Amen Clinics. I'm their clinic outreach manager. So let me see if I can still see you. Can you see my screen?
Yeah, I see.
Yes.
I'm trying to also make sure I can still see you. My computer's a little bit slower. So I'm the clinic outreach manager for Amen Clinics. My background is in kind of the neurosciences, if you will. I was a board certified neurofeedback practitioner and eating disorder treatment and mental health treatment. I also worked with kiddos who had, I think I got kicked off. Oh no.
No, I see you.
Oh, you see me? Oh, okay, can you still see
You're
me?
here.
Yeah.
Okay, well, I can't see you guys, so Daniel, just text me if you stop seeing me, okay?
Okay, yeah, so we still see you.
Okay.
All right, now she got kicked
Already? Now she's gone.
now she got kicked out. But yeah,
She had a premonition.
She had a premonition.
Yeah, so I mean, excellent. I mean, there's as she kind of comes off, I'll sort of text her to see where she's coming from. But yeah, lols. But yeah, so kind of in the meantime, as I text her to figure out where she's at, I have created a video for the first 1 year birthday, and so I would like to share that with you as we wait for her. It's not done yet, so let's share the let's share it regardless. Okay, so does everyone see it?
No.
Yeah.
No, I don't.
Share screen.
No.
You're sharing the screen, but it hasn't started yet. It's just
Yeah.
a black screen.
Yeah. It says Daniel Ignacio has started screen sharing.
Okay. All right, so it's sharing it. Oh,
I'm back.
Oh, hi, Katie.
Oh, hi. This is too funny. This is like almost like what happened the last time I presented. Okay, let me try this again.
all right, go for it.
All right, here we go, guys. Okie dokie. So, did you guys hear the intro about who I am?
Yes.
Okay. So that's what I do as a brain nerd. And at Amen, did I say the piece about, you know, healing and healing happening? Did you guys hear that piece so far?
No.
No, okay. So today I really just want to talk about healing and how healing happens. And, you know, it's multi-dimensional, multimodal, integrative process for brain injury. And the big takeaway is that you guys are not stuck either in your current situation or, you know, with the brain injury or the impacts of. Now, I'm very mindful and very sensitive to the fact that I don't have a brain injury. So anything that I say, please know that it's in a supportive way. And what I mean is that the brain, the organ, is so dynamic and so complex, and it's so capable of so much change. And I've had the opportunity to see a lot of that. And I'm going to get into a really fun case presentation that you guys will know pretty well. So at Amen Clinics, we are a functional and integrative brain-directed healthcare group. We specialize in using brain Spect imaging as part of a comprehensive evaluation process. Sometimes people come to us for psychological symptoms, mental health symptoms, and sometimes they're coming to us because they're trying to tease out what is like pre-existing psychological influencing factors, what's related to a traumatic brain injury, and how are those, you know, overlapping. I've put the research in here, but we actually did this really amazing research study where we were able to distinguish the difference between physical traumatic brain injury and PTSD in the brain, even if somebody's symptoms were exactly the same. And these were for blast injury veterans. So that was picked up actually as one of Discover Magazine's top discoveries of 2016, which was really important information and research to do because, you know, we know that if we treat a brain that has an injury in a way that is not brain injury supportive, you know, we could do some harm. So we really want to understand what's happening in a brain before we just kind of jump in and treat it or dismiss things. You know, because sometimes people will get, you know, structural brain images done and you won't always see the injury. Sometimes you will, right? And sometimes you won't. So we like to do functional brain imaging. So we do a full neuropsych battery. Well, it's not your standard neuropsych assessment. We're more interested in brain systems as well as symptoms. And we kind of get to the root cause of what's happening in a brain to really influence someone's experience. We're also very interested in genetic factors. We're interested in hormones. We know very well now that if a brain is injured, there's a really strong likelihood that your hormones have also changed. And if you've got a brain that's changed and you've got hormones that have changed, well, then the person has changed. You know, outside of this group, I think that every woman who has gone through any hormonal change in their life or had a baby and experienced that amazing flood of hormones would be, it would be impossible to say that hormones don't influence the way that we experience life in the world. So it's important to know after somebody has a brain injury, what's happening with their hormones and is it setting them up for success or not? So here's a little bit about brain SPECT imaging. We didn't invent SPECT. You can get SPECT imaging done on your heart if your doctor thinks that it is necessary. You can do SPECT imaging on other parts of your body, but we do it for the brain. And we do it in connection with the kind of like the behavioral and psychological lived experience. So we have the world's largest database of brain scans related to behavior. And this is all we've been doing for the past, 30 plus years. As a result of this massive database that we've, created, we've also come up with a very strategic plan for how to ask questions, get to the answers. And we're looking for the function of the brain, not just the structure of the brain. So our founder is a gentleman named Dr. Daniel Amen. He's just a remarkable soul. He's been a psychiatrist for many, many years. And in his earlier years of psychiatry, he was treating people and some of them were getting a lot better. And some of them were not getting better. And in some cases, some people were getting worse. And it really alarmed him. And so he started to think about it. And he's like, well, my goodness, here I am a psychiatrist and my cardiologist friends and my dentist friends, they're all imaging the parts of the body that they're treating. Why am I not imaging the parts of the body that I'm treating? So he started doing nuclear medicine studies on the brain for people who were medication and treatment resistant. He got a ton of blowback. 30 plus years ago, the research community kind of really reared its head and said, hey, this should only be done for research and studies. And he goes, but why? If we're going to potentially hurt somebody by giving them the wrong medication or the wrong intervention, we need to make sure we're doing the right thing first, especially if we already know that they're not responding. And he quickly became so committed to this because by doing it in this way, he was getting amazing results. And so he's a very outcome, very science driven and motivated person. And he's also a guy with a really amazing heart. Like, I can't believe that I get to work for his organization and with him because he's just got a heart of gold. He doesn't really see many of his own patients anymore, but that's because he's busy training everybody else. So the concept here is that, and I don't know what all these little red arrows are about. I don't know if I did them. I don't even know if you can see them, but we're just going to roll with it. So the concept is, if you have a chest pain, you're going to get an EKG. If you have a seizure, they're going to do an EEG. If you're pregnant, they're going to do ultrasounds, especially if they have questions, especially if they want to see what's going on. If you have a broken bone or they suspect that you have a broken bone, they're going to take an x-ray. They're going to take a look, and they're definitely going to take a look before they set it. And then I joke and I say, and it's not a joke, it's totally the truth. My dentist is my friend and I adore her. She's darling. She's not drilling on my face until she's taken an x-ray of my teeth. I mean, these are all just, in any other practice of medication or medicine, they're imaging. But with psychiatry and brain-related issues, they're kind of guessing. So our approach is, we call it the four circles approach, but it's quite a bit more than that. So it's biological, psychological, social, spiritual, but it's also brain systems. So we are interested in the symptoms, but we're more interested in the systems. So what that means is we're more interested in what brain systems are being impacted versus just a list of the symptoms to give a diagnosis. So what brain imaging shows us? So the picture on the left is a surface view. Color doesn't matter so much. What you're looking for are that it's fluffy, that there's not a bunch of divots and holes in it, because divots and holes show us what's called hypoperfusion, so lack of blood flow. When I came when I was on right before I started talking, I was listening to you talk about blood flow and movement. This is what we're looking for. We're looking for blood flow and movement. The image on the right is an internal active view of the brain. So what you're looking at here, that red image at the bottom, that's supposed to be there. So that's kind of think of that part of your brain as it's called the cerebellum. And it's very what's called neuronally dense. So there's a lot of neurons. It's very densely packed. So there should be quite a bit of activity there. So that's all normal, that's or typical or average, if you will. So the process is when somebody comes in, ideally we do 2 scans. We send you about 20 pages of intake paperwork. It's biological, psychological, social, spiritual, but it's also brain systems directed, like I said. You do a single scan while you're resting, and then you come back the next day and you do a scan while you're concentrating. You do neurocognitive assessments online. They are these designed to be dreadfully boring tasks. We want to test your concentration, your focus. We want to see how you bounce back from making mistakes. We ask you every question we can possibly think of, all the way back to, how your parents felt about their pregnancy with you, because we want to understand how many of the factors that are influencing your situation now are biological or psychological or social. You then meet with a psychiatrist for 2 hours, and then after that, you have 4 follow-up appointments. So we are really interested in tracking outcomes, and that's why we do these follow-up appointments. So the whole point with the 2-hour meeting with the psychiatrist is that we want them to go over with you how everything you're experiencing fits into the context of your unique brain situation, everything that you have going on with your brain. And what's really important is that our outcomes are really strong. So 79% of the time, the original diagnosis that somebody comes in with when they come to see us, it changes. And this is even if their very highly skilled psychiatrist, therapist, physician refers them over. And in fact, that happens a lot. A psychiatrist will say, hey, I've been working with this person for a long time. They reported that they played football, but they said they never had a brain injury. But there's this intervention isn't working, and it should be. We hear that a lot. It should have been working. They should have improved more by now. And then our outcomes are really strong. We've actually done some pretty wonderful outcome studies showing that 85% of the patients who work with us, they report having a much better quality of life after going through the evaluation process with us, and also following the recommendations. And oftentimes when people see their own brains, they become a lot more compliant because it's their brain. It's literally their brain. It's not like, oh, okay, people who have these symptoms take this medication and then you don't really know. It's so tailored to you and to your brain that it really gives you an opportunity to execute on a treatment plan that makes sense for you. So I'm going to give you some other cool images. So again, on the top, those pretty images on the top, those are average, typical, healthy brains. The lumps and the bumps that you see are normal just from the brain sitting inside of that lumpy, bumpy skull. And then the internal active view, that's also a typical average brain. And when I say active, what I mean is internal. On the bottom, here are some really dramatic pictures. We don't often see brains like this, but this is, just by looking at this, I can tell you that this is a toxic brain. Sometimes when we see this pattern, we do see it, substance use or mold exposure, toxicity, heavy metals, stuff like that. But the surface area of the brain can change in many different ways. And again, where you see those holes, that doesn't mean the tissue is not there. What that means is that when we ran the test, the scan, blood flow didn't go to those areas of the brain, which also doesn't mean that it can't heal, which brings me to another really cool case study, and one that you will all know very well. So this is a picture of a guy that we like to help. This is kind of, we just adore him. I think he's a great patient. And jokingly, I say that he's a patient, but Daniel really invested in himself, and he invested in you guys so that he could feel that he really understood the process that we do. I mean, I feel like if anybody knows about their own brain as much as anybody could, it's Daniel, but he really wanted to understand what happens in this process. So he went through it himself, and it's just been remarkable. And I think the takeaway from Daniel's is that healing happens. And here's how. And I'm going to show you some more images of his brain, but I also want to make sure that I give you all some really wonderful takeaways. So at Amen Clinics, we like to use an acronym called BRIGHT Minds. And essentially, these are kind of like focused on the 11 major risk factors or opportunities that influence brain health. And it's not one or the other. It's kind of a combination of all of them. And none of it's done perfectly, right? I mean, none of us have a brain perfect lifestyle. But the big takeaway with Daniel is that he lives so many of these bright mind approaches that you couldn't stop him from healing himself. And the concept is that if you put your brain in a healing environment, if you put yourself in the presence of other supportive people who get you, if you reach out and you connect, if you do brain exercises, if you do all of the things that you can do, you can really override much, not all, right? I mean, it all depends. The brain is everybody's situation is different. But when you do the things that Daniel has done in his life, it makes a difference. So really quickly, just as you go through your life, think of things like, is this good for my brain? And the biggest one is blood flow. And we're going to talk about blood flow and hyperbaric because I heard that come up a lot too. So B is for blood flow, R is for retirement and aging, but that actually has more to do with isolation than retirement. So you guys being in this group together is wonderful. Inflammation. I heard some people talk about doing things that are regarding allergies, and that if they have an allergy to something, they have a lot of inflammation. Yes, absolutely. That impacts blood flow and your brain health. Genetics. We need to make sure that people are using, if they need to use medication, we need to make sure that your brain can metabolize the right medication. My brain metabolizes dopamine too quickly. How this is evident, if I'm bored, if something is boring to me, my brain just won't hang on to dopamine. Nothing is interesting to me unless it's interesting to me, and then it's really interesting to me. The diagnostic for that is ADD. Do I have it? Absolutely. Do I have to feel bad about it? Nope. H is for head trauma. That's what this, is all about. T is for toxins. So we want to make sure we keep our toxic load down. M is for mental health. I is for immunity and infections. And then N is neurohormone deficiencies. Vitamin D is a neurohormone. Lots of people don't know that they can improve their tendency to reach for sugar, feel depressed, improve their sleep cycles just by having their vitamin D levels a little bit more balanced. And that's what I mean by understanding hormones after brain injury. All of these things can help. And then diabetes. So this isn't about necessarily weight or good or bad or any of those things. It just comes from a research understanding that as your weight goes up in an unhealthful way, the function of your brain and blood flow reduces. So we're not going to nail it. We're not going to get it perfectly. But, I do spend a little bit more time after having come to work here. My mindset has shifted from, is this going to make me feel more like my food choices are more based on like, am I going to feel sluggish after this? Or should I skip this snack, or should I just take the time to go and grab one so that I can fuel my brain? And then sleep. I heard a lot of you guys talk about this. Sleep and energy. Oh my goodness. For brains, it's so, so important. Some things that you can do, neurofeedback. I used to be a neurofeedback provider. We offer neurofeedback at Amen Clinics. I know that you guys have done some education with Dr. Block. I adore her. She is wonderful. Neurofeedback is a great way to train your brain how to train itself. That's the easiest way to put it. The brain is super efficient, but it's also very lazy. So as soon as it learns it can do something, it will kind of just continue doing it. And neurofeedback is a really great way to leverage that efficiency of the brain. Hyperbaric oxygen treatment. So essentially how it works is blood flow that's good for the body is good for the brain. Anything that's happening in the brain is happening in the body. Anything that's happening in the body is happening in the brain. It's a very integrated system. So when you put your body, so think of it this way. Gas, which is oxygen, under pressure will dissolve into liquid. So, or dissolve in liquid. So the concept is we put the body under pressure and then we pump pure oxygen into that chamber. And the lungs are naturally able to then suck up more oxygen more efficiently. And then what happens is all of that oxygen gets to all of the cells in the body, turning over, injured cells that are injured. And also too, if it's happening in the body, it's happening in the brain. So I had a gal come down to the clinic one time and she was telling me that, she was the oh boy, oh no call for surgeons in Beverly Hills when they would have, a surgery that wasn't healing properly for their patients. They would send their patients to do hyperbarics with her so that the cells would turn over more quickly, would heal more quickly. The blood, and all of that is blood flow and oxygen. We do the exact same thing. We just do it for the brain. It's the part of the body that you can't see. You are all experts on this. If your brain bounces around inside of your skull is super hard, very, very sharp, and your brain is very soft and squishy, and it can get injured. It gets a bruise on it, just like, you get a bruise on your arm. It gets cut, just like if you have, an infection that isn't healing correctly. So we're just doing the same thing on the inside of the body that's impacting the outside of the body. And then I put a little bit of information on how it works there as well. Some other things that you can do, education and learning, reading, understanding more about your brain injury process. We actually do have a course on healing concussions and concussion rescues. Dr. Chapek is one of the most wonderful people. He's a naturopath, but he has psychiatric training, and he actually has done some of the research on standing up versus lying down CTs and MRIs, because what they're finding is in brain injury, people aren't getting adequately diagnosed or accurately diagnosed either, because if you do those studies while you're laying down, the pressure is not the same. So he goes on and on. He talks about a lot of these different concepts, and then he has different strategies for healing your brain. So you can do it through the video course, or you can read the book, and then also what you're doing with Daniel and doing with this group. Some other interesting information is, this is the study that I was talking about. This is actually a link up here that you can go to, and it talks about the research that we did between the TBI and the PTSD group. And what you can see is that there's the healthy scan, the PTSD scan, which is almost detected entirely on the inside active view of the brain, and then the classic TBI, and then both. So we really needed to tease out what was what and where the crossover was. So this is a story, and now this is the fun part. So I wanted to give you guys lots of resources first, but then I wanted to talk to you about Daniel's scan. And my point is that this is what can happen. And I want you, when you go through, see his scans, and I'm going to let him actually speak to this, but what you see in your brain does not determine your destiny. It's what you do with it. And so by living a brain healthy lifestyle, when everything that he has done supports his brain health, he was able to override so much of what he was working with. if you will. So Daniel, do you want to touch a little bit on your experience, what you learned from your scans, and just tell everybody what they are seeing here?
Yeah, so generally speaking, so I was really surprised when Dr. Amina was telling me that he definitely could see my injury still. And it had been 13 years and some change now. So, I mean, January 8th, 2008. And so when he told me he could still see my injury, I was very surprised. And when he showed it to me and I saw, like, I had cerebral edema on my left hemisphere, I had hypoperfusion on my right hemisphere, I had indent on my right prefrontal lobes, right? There was so much in my cerebral, in like the corpus callosum, so my left side and my right side don't talk to each other. And there was so much of these things that I thought, I was like, wait, hold on, how is that possible? I've done this and I've done that. I'm fine. I'm good now. And I was really angry at the very beginning. I was really upset in the very beginning. And then I realized, like through the conversations with Dr. Amina, I realized, well, that is objectively what you see. But functionally, I could overcome it. I was in the right support. I was in the right family. I found you guys, right? It was like really, really great. We've been able to connect 52 straight weeks today, right? And so there's all these things, that strategies that we built in, different avenues of support systems that I've built in. And through all of these things, my deficits don't really look like deficits, right? And so, which is really such an important and powerful thing for all of us, is that in the right system, your brain injury does not have to be impactful. And I thought that was the most significant thing that I had gotten through this experience, which really, I only took this experience because all of you guys were so interested in it. And so I figured, well, what better way to speak about it than to do it? And this is what I had learned.
Mm-hmm. And I want to say something. So when so Daniel, and you and I have talked about this, I had anticipated, because of how extreme your story was, I had anticipated that there would be some functional, long-lasting impact. Like, because we have people who, barely bumped their heads and they have long-standing functional, when I say function, I mean blood flow function impacts. So I had assumed on some level it would still be apparent in you because of you were in a coma, you had to relearn all of these things. So I had a feeling that that would still show. And I was wondering what that might be like for you, like how that might feel. But I want to show you guys something else pretty remarkable. And now I would not say, not by any stretch, am I like the pillar of cognitive performance. In fact, I'm not. I have processing issues. I have dyslexia. I do have ADD. And when I had my daughter, I was really struggling cognitively. It's improved some, but the truth is, you guys, it was kind of just an amplification of what I had already always been going through. And so as I was preparing for this talk, thinking about, well, like, how do I explain to people how this looks in the real world? I asked Daniel, I said, Daniel, would you ever look at me and walk away with any sort of belief that I have a brain injury in the traditional sense? And he said, no. And I said, well, I want to show you something. So on the left is Daniel's overall brain health score. His overall average brain health score is at a 5.1. On the right is mine. It's 4.5. The reason why this is significant is because The only areas where you see that he is impacted is in like motor coordination, maybe emotional bias, which, and I don't want to make a stretch here. I have to be careful with what I say. I see that men, and I'm being very mindful of this, men do not have as high of scores in that area, but this is averaged for, I'm going to move this little window so I can continue saying what I'm saying and still see it. So it seems like there's a strength for women. We're able to discern emotions a little bit better. And also I am too, just in general, because that's the type of person that I am. I have the type of personality where if I step on somebody else's toes, I feel it. Like that's just how I am. But if you look at my scores, like my goodness, who here has the brain injury? If I were to look at this, it's me. Right? So, and I wouldn't say, and that's the thing about doing brain imaging in this way, is that that's why I say we are so after the brain systems and not the brain symptoms, because Daniel has done what it takes to have an overall brain healthy score. And in so many ways, I'm way far behind him, way far behind him. And so I don't know if my message is coming across as clearly as I hope, but my point is that you are not your brain injury. And sustained attention, like if I just look at this, and my working memory, my depression levels, my resilience. I struggle with resiliency, my social capacities. All of these things are not just average, they're below average. And look at Daniel's. I mean, my goodness, he is so far beyond typical or normal. That's kind of my point, is that you are not like stuck in any way because you have had a brain injury. And you are not just the brain images that you see. It's so much more than that. And he proves that. Now I've got some work to do, clearly, and I'm working on it. But I mean, it's really wonderful to me that I actually, get to meet you all. And then I get to use Daniel as one of my, motivating people in my life. So that is, and I put some fun things in here for you because I want to definitely open it up for questions before I have to go scooch to get the little one. But this brain type test, where it says brain type test and it's underlined, that's a link that you can go and you can take a test. It's not super clinically accurate, but it is fun. It'll kind of give you an overall brain score, and it'll make recommendations on different sorts of supplements that might be supportive. If you're interested in figuring out if you have ADD and which type, because a lot of different things can look like ADD. So you can check those out. And then down here, I've just given some other different scans. And then I wanted to show you this. So this is a little boy who had fallen down a flight of stairs when he was young, and he had ongoing behavioral health issues, and they had only ever addressed the behavior. They kept putting him into behavioral intervention courses, treatment centers, on and on and on, failure after failure, and then nobody had ever looked at his brain. And Dr. Amen did. He said, well, I feel like it's kind of cruel to put him in a behavioral modification program when behavior is not the problem. He needs to heal his brain. So it's just really interesting, like the things that you can figure out by looking at your brain. I've put a couple of pieces of information about our team. I've put some more information about the NFL studies that we've done. I just kind of loaded you all up with lots and lots of information. If it's too much, don't feel obligated to jump into it all. It's just for you if you want it. And thank you so much for having me.
Thanks, Katie.
All right, thank you very much for your time, everybody.
Yeah, that's great.
Woo.
This was awesome. Thank you so much.
You're so welcome.
I have a question on the I heard that on the hyperbaric, is it true that the brain will go into a protection mode and that you can have too high of oxygen or something coming in?
I've not heard that. And what I would say is definitely if you're gonna do hyperbarics, make sure that you do it under the care or the prescript, like if you have a physician that's recommended it for you. That's kind of I've not heard of that, but I don't know if that is true or untrue. And I would say when you are managing and healing from a brain injury, making sure that you do it under the supervision of a physician is probably the most important thing.
I have a question. You, in the beginning of the slide, you showed like PTSD brain, TBI brain, TBI and PTSD brain. And you said you have the largest database of Spect scans. So I have ADHD too. And with my genetic markers, it happens to be the worst type of ADHD. And my brain damage was from 2 years ago. And before that, I was suffering from ADHD, as well as some like cognitive problems. And I had a trauma, so I may have a PTSD before the accident. Plus, my accident was enough traumatic, so I may have a PTSD after that. So in order to target those properly, do you, sorry, let me move there. Are you be able to tell the difference between the TBI, the PTSD, the ADD, and like tell us like with your data, tell us which one is related with which?
I sure can. You know what, I was, since you asked, I'm going to show you something. Yes, you can. So I put, my brain. So I have traditional, sorry, I'm hearing some feedback. I don't know if that's my computer. So yes, we can. Let's see what I put here. So here's my brain when I'm trying to concentrate. Dreadfully boring task. No one should ever have to do it. Apparently it's not a big deal for people. It's a struggle for me. And you can see that, like in my frontal lobes, the blood flow literally goes away. It's as if that part of the brain isn't functioning. The harder I try, the worse it gets. And down here, you can actually see I get a spot of hypoperfusion. So this area of the brain, this back area of the brain, right where that hole is, there is now research that shows very clearly that there is a correlation between executive functioning, mood control, sustained attention. So is it any surprise that when I'm trying to focus on something boring, I'm also losing access to that part of my brain? No, not really, but it's really worth looking at. Now, looking over here, I have, and I took the triangle, like there's a diamond pattern that I had over here. You guys have been so honest and so transparent with me. I'll share with you. Emotional trauma is part of my life. I work on a regular basis. You know, it's part of my story. It is very apparent that pattern is here. Now, check what happens when I try to just sit and hang out and relax. Well, my blood flow goes a lot better to my frontal lobes and back here to this. Remember that hole that was there? It's not there anymore, which shows me that it's not an actual physical injury, because if it was an actual physical injury, it doesn't really matter what I do. I take that back. Physical injuries can look worse depending on what you're trying to do, which is why to the person who said, oh gosh, when I'm exhausted, it's done. Same, I mean, their brain, I bet you anything would mirror that. What I'm trying to point out here is look how much we call it hotter. On the active scan, I don't know if you can see my mouse moving, but on the active scan, when I'm resting, when my brain is asked to do nothing, I'm left alone in a room just to hang out by myself with my thoughts, my brain goes a little bit, it gets turned up. Like I'm not able to really fully calm down. And that's because my trauma networks are really lit up. Now, this got a lot worse after I had my baby in the pandemic, and my husband's a firefighter medic and he was on the front lines. I was stressed out. It got worse, but this has been an ongoing thing for me. Now, on top of that, I got pretty darn depressed. So you wouldn't even believe what my doctor put me on. Not an antidepressant, not just an ADD medication. He put me on an anticonvulsant. I've never had a seizure in my life. I don't have any reason to be on that other than research is showing that if you have ADD but you have trauma and your brain survival networks are so kicked up all the time that it can't calm down, any ADD, intervention in the world won't really work that well because your brain is already so geared up. So while my frontal lobes are sleepy, as evidenced by the scan, it's too hot on the inside. So before I could really tackle my ADD in a way that made sense, I had to address my trauma. And two of the ways that I addressed that trauma was to do EMDR and to get on an anticonvulsant. How in the heck would I have known I needed to be on an anticonvulsant because of my anxiety? So yes, those are the ways that we were able to distinguish it. Now, keep in mind, I've worked here for 4 years, and this information was still mind-blowing and life-changing for me. So I don't know. I hope that answers your question.
That does. Thank you. So basically, like, you are able to like mine all the data that you that you have and tell us which one is related with which, right?
Mm-hmm. Yep.
Great. Thank you.
And not only tease it out, but say, okay, this could belong to this, and this could belong to this, and here's how they cross over.
Amazing. Thank you.
I had a question here. So it was the pricing for this kind of packaging for the different kinds of services, and if we could get some kind of discount, right?
Yes, absolutely. I mean, anybody.
Yeah, I figured I'd ask. You're right.
No, absolutely. Anybody that Daniel refers, please just make sure you mention, Daniel's name and the St. Jude Traumatic Brain Injury Network. Just say that, and we can extend a 10% discount to you guys.
Oh, awesome. Awesome.
Yeah.
Thank you.
You just have to really say it, because then they'll ask me like, hey, do you know this person? I'll be like, yes, I do. So that 2-scan full evaluation that I just went over with
email. The email from, she's trying to look at the
text.
email.
Wasn't an email, it was a text.
Okay.
Oh yeah.
You still have it.
So what's the regular pricing then?
Okay, so the 2-scan full eval, I'm looking over at my price sheet that's on my mirror that I wrote, is $44.95. So $4,495. And then we do have care credit, which is no interest financing for a year. A lot of the question I also get is, do we bill insurance? Unfortunately, we do not bill insurance, because insurance just will not let us do all of these things in the order that we need to do them in order to get the answers that we've been able to get. But people do sometimes obtain or work on getting reimbursement after the fact through super bills, and we have all the codes for that.
Is it something you can do all in like one day or 2 days, or is it something you have to keep traveling back and forth for?
So the only thing you actually physically have to come into the office for are the scans. Pre-COVID, we already did a lot of telemedicine, because that was people's, people will travel to us if they want to, but usually it takes a while. So we'll send you the paperwork, you'll fill it out, you'll send it back, you'll sign all the forms, you'll have a loved one fill out the exact same questions. The reason why this is important is because my husband rates my anxiety at a 4. I didn't rate it at a 4. That's important information to have. And then you fill all that information out. Then you have a history appointment for an hour to an hour and a half. You can do that over the phone or over Zoom. And then you come in for the scans. If you're doing 1 scan, you can just do the 1 scan, or you do 2. You do one day, come back the next day, do another, and then the rest of it is all just done online at home. Our doctors will see you over Zoom. So the only thing you physically have to be there for are your scans.
Okay, thank you.
You're welcome.
Close to Mesa, right, Katie?
Mm-hmm. Yeah.
Where?
So it's on Bristol, right off the freeway. Do you know where that red PBS building is?
Yes, I do.
That's where we're at.
Okay.
Hey, other questions for our lovely guest? Yeah,
I think no question, Jess is really good for all this information.
Awesome information. Thank you so much. I've never been so
I
well.
mean, I can ask one more question.
So can I, so I'll go after you.
So you said substance abuse, and I'm following Dr. Amen on Instagram, and he was mentioned about marijuana or cannabis, and I've seen some improvements with cannabis. So what do you see in the TBI people? Do you count that as a substance, and does it cause like the lessen the blood flow?
So I want to be very careful with how I answer this, because I think that every human being is different. Your situation is different. The research has shown that unfortunately long-term pot smokers do perform lower on every cognitive task available. And also, you know, there is a toxic element, right? So as a first line of treatment, up to 10th or 11th line of treatment, like we just don't, we've just not seen the research that adequately backs it being a brain healthy substance long-term. If the research changes, if benefit, and we just look at things a little bit in the sense of, is there a toxic factor, right? Is like, was this made with pesticides? Is this going to be smoked and then inhaled? Because all of those do different things. So I would say what works for you works for you. And if there's no blanket response or answer for anything, we have not seen it be beneficial. That doesn't mean that it isn't, you know.
Great. So awesome. Thank you very much, Katie, for all your time. I do realize that it's right at the moment we need to leave to go pick up the youngling. And so give our very best regards to your husband and to the youngling. And so if everyone here, we can please thank you very much for your time, Katie, and Alien Clinics. We'll send over the slides so everyone will get all the information. And if you have any questions, you can send them to me and I can email them to Kate.
Oh my gosh, well, thank you guys so much. And then Kelly, I think you did have one more question. I can answer one more if you have it.
Okay, I was just wondering if you do the neurohormone deficiencies, if you guys test for that yourself, and then do you have the supplements or whatever for that? And also if you do the hormone, neurohormone, do you also check the pituitary?
Oh, that's a question I like. Okay, I'll stick around for that. And I just saw my husband walking around with the lawnmower in the back. So, anywho, so the pituitary gland, this is super interesting. So we can test for hormones. Like we have an integrative physician on staff. His name is Mark Philaday. He's a genius. That's part of what he does. You would go and you would do the blood work wherever you get blood work done, and then he would review all that information. Now, the pituitary gland, this is what's really interesting. So we don't think that Spect is better than any other form of imaging. It depends on what it's for. So, wow, I'm just going to get totally transparent with you guys. I had a really hard time conceiving my daughter, and I had a suspicion that there was something going on because I always had like subclinical thyroid issues, subclinical hormone issues, and I wanted to get brain imaging done that was structural, because like I had the, brain health stuff under control as far as blood flow goes, but I didn't have structural piece. I wanted to see my pituitary gland. Lo and behold, I have what's called a small cerebral cleft, and it's letting fluid go in toward the posterior area of my pituitary gland, further pushing the front part of my pituitary gland forward to where it's a hard seat. So you have inside of your brain, there's a hard seat, pituitary gland. We can't see that. We can't see that in SPECT imaging. So I had to go and get an MRI done to find that. So no, we don't check for that because we're checking for blood flow and function. And that's like this SPECT imaging doesn't give us that.
Okay.
Okay, thank you.
You're very welcome.
Thank you.
You're very welcome. Well, you guys, thank you for having me. I really mean it. It's an honor to be here. Thank you for trusting me.
Thank you so much.
Thank you, Katie.
Okay, see ya.
See ya.
You.
Bye. Thank you.
You're welcome. Bye.